And then what did you do after?
I went to the renal unit. I still had this hankering after renal medicine, and I went to work with Jim Robson's as SHO for a year, from 66 to 67.
Now that was very exciting.
Oh, it was exciting. We just started nocturnal dialysis, and it was exciting. It was sharp-end stuff with some alarming days and nights.
Tell me about that. Tell me what you remember about those days.
Well, the funniest one was we rigged up a new system. It was Jim Petrie and Tony Martin and myself had rigged up a system of draining the dialysis. And unfortunately, someone had moved a bed and the wheel had gone in the drain, which meant the whole thing had built a back pressure. So these three poor people who'd been dialysed were sitting there with a great shower of dialysate coming down on top of their heads, one up with an umbrella up. And they phoned me. I lived in a flat in Newington at that time. I just got married. And I went in and we managed to sort it out. A very strange scene. Very strange scene. But it was sad because we got to know some of the patients, and I got a bit soft, and that's why I stopped wanting to be a renal physician, because when patients ran out of radial arteries, basically they got diamorphine and a high protein diet in a corner bed, and I didn't like that. And also some of the youngsters, there was a wee boy from Woodburn, I remember who was called Douglas Allen, and I had to beg, borrow and steal beds all over the hospital to do peritoneal dialysis, and you probably even remember it. Liz Shaw was very good at him, and he died, and it got too emotionally traumatic, I thought, in nephrology at that time. The transplant program wasn't really properly underway by that time. It was being set up, and people were working very hard at setting it up, but it wasn't properly underway at that time. It was very much the sharp end stuff.
So that the principal way of treatment was by dialysis.
Yeah.
Was there intraperitoneal dialysis?
It was usually as a sort of stopgap until patients could find a space on the hemodialysis program,
right,
basically.
And what was the relative merits of peritoneal dialysis and standard arterial dialysis?
They found peritoneal dialysis painful, and they'd go on for about 24 hours, having about 1.5 litres to 2 litres of fluid infused, and then drained out after an hour, and it went on for 24 hours. They were tied to a bed for that time. Hemodialysis was over more quickly, and once we started to get the hang of preventing disequilibration, which we hadn't understood earlier on, it was much more effective.
When you mean disequilibration, what do you mean by that?
They changed in the osmotic pressure in their blood, and it hadn't changed in their CSF, so they got terrible headaches.
Right.
But we answered that with putting a lot of glucose in the last bath. We got better at it over the year, but it was too traumatic. We had a hemodialysis went wrong one night, and it was Jim Petrie and Tony Martin were there, and obviously something had clotted somewhere where it shouldn't have. And Jim grabbed what he thought were a pair of artery forceps to clamp off a line, and they were actually a pair of scissors. And I spat off blood went all over everybody. I think it was Tony Martin's anniversary. He was all dressed to go out. Another image from those days, and that was in Ward 21.